Welcome to another edition of the Healthcare Executive Talks podcast series, a presentation of Healthcare Executive Exchange magazine. We're located at healthcareix.com. Today's conversation is with Dr. Deepak Kapoor, President of Advanced Urology Centers of New York. This is part one of a three-part conversation on how Advanced Urology incorporated patient satisfaction into its corporate culture.
We who have been delivering healthcare have often had different impressions of what constitutes patient satisfaction than the patients do, and it's kind of an interesting dichotomy, and aligning and bridging that gap, because sometimes the things that patients value don't necessarily have anything to do with their healthcare and their outcomes, and having them realign their view to value the things that are really more important to their health is important, but by the same time, having physicians and other healthcare providers understand that the patient is your client, is your consumer, and as the individual that's ultimately paying for the care has a right to certain expectations in the level of experience that they have. That it isn't simply enough to deliver a good product. You have to deliver unless that's where you're trying to market yourself. You look at different industries and different companies, and they've identified what their metrics are when they look for patient satisfaction. So for example, if you walk into a Walmart, you're not expecting a very high degree of customer service. They're not branded on that. You're expecting a certain degree of selection and a certain amount of availability and a very specific price point. And you've walked into a Walmart with an expectation of what it is that you're going to receive. And so if you can't find a salesperson that knows anything about your product, well, you know what, you expected that. But by the same token, if you walk into a Bang & Olufsen or a Neiman Marcus or a high-end retailer, you're not going to expect to pay that bargain basement price, but by the same token, you're going to expect a little bit more in the experiential side of the transaction. And that's something that in healthcare that we've not paid any attention whatsoever is to try to align what we're delivering with the patient expectation.
I was talking to another guy the other day in Cleveland. He runs their public health system there, Metro Health. And he made the allusion in discussing competition and collaboration. He pointed out how hospitals have existed in these silos all along, yet out in the public square, in public industry, you have banks who aren't just competing, they're also collaborating on community events and everything while remaining competitors, and yet that seems to be completely foreign to hospitals. So what you're saying, looking to industry, looking to customer service and in shops really resonates. Why do you think it's taken healthcare so long to see the value in looking to the public sector?
Well, because healthcare is a very unique industry in that for the longest period of time, the individuals that are consuming the service have not been the ones that have been paying for it. So,
right.
So you have a third-party payer. So your employer is buying your health insurance. You're consuming the product. The costs you're insulated other than the effect of your deductibles or your coinsurances. If you're a Medicare patient, you have, again, the Medicare deductible. You have the coinsurance amount that Medicare Part A or Part B doesn't cover. But really, it's been that. The consumer of the service has not been the one that's paying for the service. And in healthcare, that's really a very unusual model. If you think about it, where else does that occur? I don't think that you walk into a Starbucks and pick up a cup of coffee and expect the guy behind you in line to pay for it. It just doesn't happen anywhere else. But what we're seeing now is that there is becoming so much more transparency on the cost side, which is extremely important because really fundamental tenets in the Affordable Care Act and with these health insurance exchanges, what we're seeing is a transference of cost not only to the patient but also to the provider. So the provider is taking increased responsibility over the cost of the services that they're ordering, and they're being held accountable based on those costs. So, you can't just come in and have a patient say, well, doc, I want a CAT scan of my abdomen, and the doc says, well, geez, that's great, but you came in with an itchy nose. Why do I want to order a CAT scan of your abdomen? And the guy says, well, I just think I should have one. And the doctor historically would say, it's no skin off my nose. Here's your CAT scan of your abdomen. But we did, and the whole avenue of medical malpractice risk and the fact that people practice defensive medicine. I mean, there are so many reasons why utilization has been driven beyond necessity. And I don't think that there's any question that we utilize more services than we absolutely need. But the difficulty is that the expectation of the patient is that quality of care is associated with utilization of services, and that's not necessarily true. So these are, before you can find out what it takes to make a happy patient, you have to ask them, and so you have to ask them, what are they looking for? What are their expectations? And that was really how the impetus for this all started for us, is that we were interested, as we discussed before, we're the largest group of our kind in the United States. We do about 18% of the urology in the state of New York, and about 1.5% of urology in the United States. So, and I understand that urology represents a relatively small percentage of healthcare, but in that small percentage of healthcare, we're an important component of it.
I would say
and so we said, if we want to deliver best-in-class service, part of delivering best-in-class service is not only to have the standardized clinical pathways and evidence-based medicine and that, but it's also to make sure that the patient experience through the system is a positive one. You have to make it so I don't want to have it to be a situation where people are coming up to us because they feel they have to. I want people to come to us because they feel that they want to. That
right.
Not only are they getting the best care, but they're getting it in a compassionate and considerate manner that is respectful of their needs and wishes. So, and the other aspect to it was that in the Affordable Care Act, there's something known as the value-based modifier. And a significant component of the value-based modifier, which accounts for 2% of Medicare reimbursement, is the response to patient satisfaction surveys. So the value-based modifier has been instituted for inpatient care for hospitals starting in October of 2012. And in hospitals, 30% of the value-based modifier is based on what's known as the CAHPS, C-A-H-P-S survey. For groups of our size, starting in 2015, we're going to be, for groups of 100 providers or more, our patients are going to be receiving what's known as the CG-CAHPS survey, which is the clinic and group is CG, and then CAHPS is the consumer assessment of healthcare procedures and systems. And the hospital's been operating on something that's known as, which is hospital-consumer assessment of healthcare procedures and systems. It's two different questionnaires. But 30% of the hospital reimbursement is based on their response on how they rank, and it's not a criteria-based scoring system. It's a normative-based scoring system, which basically means that hospitals are being graded on a curve. So they've been subjected to this in 2012, and you can see, not a day goes by without some hospital system or another being penalized, tens to hundreds of millions of dollars for failing to meet all sorts of variety of quality parameters. So we recognize that not only was it important to us from the standpoint of where we wanted to be as a group, but it was also in the future going to be very fiscally important to us. And we try to be proactive on these changes. We don't want to have a change foisted upon us, and then we're scrambling to modify our behaviors to react to it. When we know something is coming down the pike, we're proactive and institute the changes in advance, so our systems have the time to adapt to those changes and incorporate them as part of the corporate culture and our workflows.
So when you started to look, how does an initiative like incorporating patient satisfaction into one's culture, how does it start to take shape? It's more than just a survey. How do you communicate that to your physicians? How do you communicate that to your professionals?
Well, what we did is we did it and that's a great question, and that's really more of it even goes beyond the operational way about how you go about it. You have to get people to buy into it. And I'll tell you, we started with the first time we started doing it with some internal questionnaires. Basically, we consulted the Oracle at Google and downloaded these patient questionnaires, and we started distributing them. And we said, all right, people. But we have 55 offices, and some providers had bought into it, and some didn't. And we got a good response rates in some places and no response whatsoever in other places. And we realized that, and what we basically got after doing this for a few months was a pile of utterly meaningless data. There was no statistical validity to what we were doing, and it was meaningless. It was an utter exercise in futility. So we said, all right, you know what? We obviously can't just do this, pull it up by our bootstraps and just do it. We don't have any experience in it. It's not something that is intuitive to our doctors or to our work processes. And quite frankly, our initial effort at this, we fell flat on our face. But I think that it's a very important concept of leadership that you learn through failure, right? So, and we failed abjectly. So, but it wasn't an expensive project. It wasn't anything that was damaging, but it was a very valuable learning experience. That it is almost impossible for you to really create an internal model to objectively evaluate your own processes.
Right.
And so we said, all right, let's go out, and we went to a number of different vendors, and we finally settled on Press Ganey. And Press Ganey, everybody's heard of Press Ganey. They've got the largest database on this, and the reason we went with them is that they had the largest comparative database of other urology practices. Now, the big disadvantage for them, and you can write it or not, is that by far they were the most expensive vendor. I mean, it wasn't even close to who was the next best expensive. But Press Ganey has name recognition. They had a lot of statistical tools. Basically, they had a whole suite of services, and there isn't anybody that says, okay, these are my Press Ganey scores. There's nobody in the health industry that doesn't understand what that means and doesn't respect it, right? Because it is the thing that if you buy the industry leader, if you're partnering with the industry leader, you have a certain degree of credibility in terms of the results that you're generating.
And that concludes another edition of the Healthcare Executive Talks podcast series. That conversation was with Dr. Deepak Kapoor, President of Advanced Urology Centers of New York. In our next installment, we'll hear the results of the Press Ganey study, and Dr. Kapoor will also detail his development of a pioneering approach to mathematically analyzing patient satisfaction. For more information on Advanced Urology Centers, please visit their website at AUCofNY.com. That's AUCofNY.com. The Healthcare Executive Talks podcast series is a presentation of Healthcare Executive Exchange magazine. For our latest podcast and articles, please visit our website at healthcareix.com. You can also download our podcast on iTunes, and don't forget to follow us on Twitter for updates on the healthcare news of the day. Our Twitter handle is the @HCIX. That's @HCIX. Thanks so much for listening. Until next time, be well.